$1 million drug coverage reinstated for girl with rare Batten disease in British Columbia. 2. BC restores life-saving drug funding for girl with rare disease Charlie's story. 3. Community unites to fund Charlie's treatment. One dose at a time. $1 million drug coverage reinstated for girl with rare Batten disease in British Columbia. A heart-wrenching decision has just been reversed in British Columbia, reigniting a heated debate about healthcare priorities and the value of human life. At the center of the story is Charleigh Pollock, a 10-year-old girl from Vancouver Island battling CLN2, a rare and terminal genetic disorder also known as Batten disease. But here's where it gets controversial. Just last month, the province's health minister, Josie Osborne, announced that coverage for Brineura, a $1 million per year drug that slows the progression of her illness, would be cut. Now, after fierce public outcry and pressure from medical experts, the decision has been overturned. And this is the part most people miss. The reinstatement doesn't mean the debate is over. It's just the beginning of a larger conversation about how we balance medical evidence with compassion for rare diseases. CLN2 is a progressive neurological condition that causes daily seizures and irreversible brain damage. Brineura, administered via a direct infusion into the brain, has been a lifeline for Charleigh since she was 3 years old. When British Columbia first covered the drug in 2019, it was hailed as a breakthrough for rare disease patients. But last month, Osborne cited a medical review committee's findings that Brineura becomes ineffective once a patient's motor and language functions decline to a specific threshold. This sparked outrage from Charleigh's family, physicians, and advocates, who argued the drug still improved her quality of life even in later stages. The controversy deepens when you consider the broader implications. Osborne stood by the committee's decision initially, stating that healthcare choices should rely on the best available evidence. However, a letter from Batten disease experts revealed a significant split in the medical community about Brineura's efficacy. Osborne's sudden reversal, announced just days after the letter, has left many questioning whether politics, public sentiment, or new data influence the change. Should medical decisions always follow strict guidelines, or is there room for exceptions when it comes to the most vulnerable among us? Premier David Eby, speaking on CBC's On the Coast, acknowledged the emotional impact of the situation. He emphasized that health decisions should rest with experts, not politicians, while also praising the public support for Charleigh's family. Yet the story raises uncomfortable questions. What happens when evidence is inconclusive? Can we afford to fund treatments for ultra-rare conditions without clear long-term benefits? Charleigh's case is a microcosm of a global dilemma in healthcare: how to allocate resources fairly while honoring individual suffering. For now, Brineura coverage has been reinstated, but the debate rages on. Charleigh's family and advocates argue that hope and quality of life matter just as much as clinical metrics. As Osborne put it, "It is not acceptable that Charleigh and her family suffer as a result of disagreements among experts." But here's the catch. If every rare disease case is treated as an exception, how do we set boundaries? We'd love to hear your thoughts in the comments. Should medical guidelines be rigid, or should they bend for extraordinary cases like Charleigh's? And where do we draw the line when compassion clashes with cost? For more details on this evolving story, including the joint letter from Batten disease experts and the provincial government stance, visit the CBC's in-depth coverage here. https://www.cbc/news/canada/british-columbia/Charleigh-Pollock-Batten-disease-funding-pulled-BC 75666373 and here, too. BC restores life-saving drug funding for girl with rare disease Charleigh's story. Imagine being told that your 10-year-old child's life-saving treatment will be cut off, leaving them with a devastating terminal illness and no hope for a future. This is the harsh reality that Charleigh Pollock and her family faced when the British Columbia government decided to stop funding her medication for a rare and fatal neurodegenerative disorder called Batten disease, CLN2. But here's where it gets controversial. The decision was made despite the fact that the treatment, called Brineura, has been shown to slow down the progression of the disease and improve the quality of life for children like Charleigh. Each infusion of the drug costs a staggering $33,000, and the annual cost is around $800,000. The news of the funding cut sent shockwaves through the community, with many calling for the government to reverse its decision. And this is the part most people miss. The criteria used to determine whether a patient should continue receiving the treatment are based on their motor and language skills, which may not accurately reflect their overall quality of life. In Charleigh's case, she can no longer talk or walk, but her family and medical team argue that she still has the ability to interact with her environment and communicate nonverbally. The letter from a group of rare disease experts, including 11 physicians and 2 researchers from the U.S.-based Batten Disease Centers of Excellence and U.S. Batten Disease Clinical Research Consortium, highlights the significant disagreement among health experts on the use of Brineura for Batten disease. They strongly oppose the decision to withdraw funding for Charleigh's treatment and call for a review of the current discontinuation criteria. The experts argue that the criteria do not take into account important factors such as cognition, feeding, breathing, reduced seizures and hospitalization, or quality of life as assessed by the family and medical care team. But what's even more striking is that the life expectancy of an untreated child with Batten disease, CLN2, is only 10 to 12 years, making every day count for Charleigh and her family. The outpouring of support from the community has been overwhelming, with donations to an online fundraiser called I Stand With Charleigh reaching almost $68,000 in just 3 days. The funds will be used to purchase Brineura doses for Charleigh and cover her end-of-life care when the time comes. As Premier David Eby noted, the donations that allowed Charleigh's infusions to continue are inspiring and beautiful, and reflect the kind of province British Columbia is. However, the controversy surrounding the funding decision raises important questions about who should make decisions about medical care and how we prioritize the needs of patients with rare and expensive diseases. Should politicians be making decisions about medical care, or should it be left to health experts? And what role should community fundraising play in supporting patients who are struggling to access life-saving treatments? These are just a few of the questions that we should be asking ourselves as we consider the complex and often controversial issues surrounding rare disease treatment. As Health Minister Josie Osborne said, decisions about medical care should be made by health experts to ensure they are based on the best available evidence. But what happens when there is significant disagreement among those experts? We invite you to share your thoughts and opinions on this matter in the comments below. Should the government be responsible for funding life-saving treatments for patients with rare diseases? Or are there other solutions that we should be exploring? Let's start a conversation about this critical issue and work together to find a way forward that prioritizes the needs of patients like Charleigh. 3. Community unites to fund Charleigh's treatment, 1 dose at a time. Imagine being told your child's lifeline is about to be cut off. This is the stark reality for the family of Charleigh Pollock, a spirited 10-year-old from Langford, who is battling a rare and terminal neurological disorder known as Batten disease. But here's where the story takes a heartwarming turn. The community has rallied together, raising over $25,000 in just over a day to ensure Charleigh continues to receive her crucial treatment. For the past 6 years, Charleigh has been receiving bi-weekly infusions of Brineura, a drug funded by the province. This treatment costs a staggering $800,000 annually but has been instrumental in slowing the progression of her disease. Batten disease typically limits life expectancy to around 10 to 12 years. However, Charleigh's future remains uncertain, especially after a recent decision by the Health Ministry. On July 11th, Health Minister Josie Osborne confirmed that the ministry would stand by its February decision to discontinue funding for Charleigh's treatment. The ministry argues that there is no clinical evidence to suggest further benefits from the drug. But this is the part most people miss. Charleigh's family, medical team, and Batten disease experts strongly disagree. They assert that Brineura has numerous benefits for Charleigh, including a life free from daily seizures. It's not a cure, but it is giving Charleigh more time, more stability, quality of life, and more memories with the people who love her, said Jory Fales, Charleigh's mom. Without the therapeutic levels of this life-sustaining enzyme, the symptoms of the disease are expected to return, leading to a deterioration in Charleigh's condition. In response, the family has launched an online fundraiser with a target of $500,000 to help pay for future Brineura infusions and end-of-life care. The new fundraiser has already raised more than $25,000 in a matter of days, replacing an older GoFundMe page that had raised over $256,000 since its launch over 6 years ago. Each dose of Brineura costs $33,000, plus additional unknown costs. "I haven't seen the bill yet," Fales told the Goldstream Gazette. So far, they have enough funds to cover Charlie's July 15th infusion and another dose 2 weeks later. Fales acknowledges that the fundraiser is not a long-term solution, but she hopes enough money can be raised to fund infusions for as long as possible. "We're taking it one dose at a time," she said. But here's where it gets controversial. Should the community be responsible for funding life-saving treatments that the healthcare system deems unnecessary? Is this a failure of the system or a testament to the power of community support? To donate to the I Stand with Charlie fundraiser, visit www.gofundme.com/f/IStandWithCharlie. We encourage you to share your thoughts and opinions in the comments below. Do you agree with the ministry's decision? Or do you believe more should be done to support families like Charlie's?